Hello, this is Dr. Bhatti, and today we're going to discuss the many differences, the 10 main differences between Sikh pattern traction alopecia and androgenic alopecia or male pattern baldness.
Darling birds, I'm gonna Darling Birds Clinic. Darling Birds is where I'm headed. For mama told me, son, there are no second chances. Love and war and hair transplant. Darling Birds.
Being situated in the Sikh heartland of Punjab, India, my practice is geographically favorable to receiving a very large number of patients who suffer from Sikh pattern traction alopecia. This commonly happens due to tying a very tight top knot, which is a requirement for Sikhs, a religious tenet which most people adhere to. This distinct form of traction alopecia is referred to as Sikh pattern traction alopecia. I get a lot of patients, like most clinics in this part of the world do, where patients compare their results of androgenic alopecia with those of Sikh pattern traction alopecia. Well, this is very unfair because the pathogenesis, the etiology, and the outcomes in both cases are incomparable. You cannot compare the results of either the timelines, the long-term preservation of hair transplant result with or without medication to that of Sikh pattern traction alopecia. One must remember that the causation, the quality of donor hair, the quality of the recipient area, the effect of DHT on both forms of baldness, the different aims and objectives of each entity individually are worlds apart. So what sets this group of Sikh pattern traction alopecia apart? Number one, Sikh pattern traction alopecia happens due to the play of mechanical forces and not due to genetic predisposition or change in hormonal equilibrium, unless of course it is coexisting with androgenic alopecia. Secondly, there is an abrupt transition between the bald area and normal native hair, and this transition can be linear and dramatic, unlike in androgenic alopecia where it is very gradual, almost feathered, and often inconspicuous. In traction alopecia, there is a varying degree of scarring in the dermis and some in the subdermal region as well. The scalp donor can also be involved in the process of traction alopecia, and this may greatly restrict the availability of good quality grafts, and hence the coverage may not be optimal even for a small area along the hairline. And this in some cases makes it a tough proposition to produce happy outcomes. Fifthly, the scalp donor may have a change of hair direction due to constant pull on the hair, and this may lead to a lot of technical difficulty in harvesting grafts during the procedure. This is never seen in androgenic alopecia. And since DHT is not incriminated in the causation of traction alopecia, DHT blockers like finasteride and dutasteride are not required unless of course there is concomitant coexisting androgenic alopecia. When thinning starts due to traction alopecia, it can very rarely, if ever, be reversed. So traction alopecia has only one cure when baldness sets in: surgical hair restoration or hair transplant in lay terms. Traction alopecia occurs in young Sikh men and in women of African descent. And both these classes of people have very high expectations from the hair transplant, which may be irrational at times. They contrast planted density with native density, which is very high. There is absolutely no thinning of hair in the area which is not involved by traction alopecia. So their reference point is naturally of a very high quality. And this is the challenge of replicating the existing density with that of what can be surgically offered to them. This may also be true of some early cases of androgenic alopecia, but when we talk of extensive baldness, the goals and objectives of the patients are pretty much humble, watered down, and this makes this group, the group which suffers from extensive baldness, extensive thinning, it makes them very rational and extremely realistic about the density that is possible and the coverage that can be achieved. The hair density that may on one hand satisfy the patient with androgenetic alopecia may be too low for that person who's suffering from traction alopecia, and especially Sikh pattern traction alopecia, because this malady appears at a very, very young age. However, what we can achieve and what is expected by the patient can be aligned through a minor touch-up 6 months after the procedure. Not too many grafts, about 200 to 500 grafts will do the trick. And this should be done at 6 months so that there is no waste of time as the patient grows his hair, so he can achieve the full fruits of hair transplant at the 12-month mark. Pure traction alopecia will not progress in time. This is unlike androgenetic alopecia, which evolves, progresses as time progresses. And that is unless there is no concomitant androgenetic alopecia coexisting or developing later on in life. So history taking is very important if we are going to give very high densities in Sikh pattern traction alopecia. Lastly, very high densities can be given in Sikh pattern traction alopecia, unlike in androgenetic alopecia, in 1 or 2 sessions, since there is no fear of the progression of baldness and there is no need to preserve grafts for future use. Well, those are the 10 essential differences between androgenetic alopecia on one hand and Sikh pattern traction alopecia on the other. If you have any questions, any doubts that come to your mind, and if you're suffering from Sikh pattern traction alopecia or any other form of traction alopecia, do write a comment in the comment section below and I'll be there to help you. God bless you.